Hello, my name is Brad Bengtson, plastic surgeon at the Bengtson Center here in Grand Rapids, Michigan, and just honored to be here with Terri DeBoer. We're going to be talking about the face today, and just really excited to have Terri here and really just kind of chat about her journey, just her beauty journey since we first met. So
yeah, for a little more than a decade now.
Yeah.
I've been a patient here at the Bengtson Center, and I know Dr. B, you and I have become friends through my work in television. I worked in front of a television camera for the better part of 40 years.
Wow.
And as a woman aging, we know that making sure that we continue to have a youthful appearance is super important. And so as we became friends, as you became a frequent guest as an expert on 8 West,
Yeah.
and then as I eventually became a patient of yours, I really came to understand that it really is a continuum that we have to look at in terms of a journey
Yeah.
when we think about maintaining a youthful appearance in a way that looks supernatural.
Right. Yeah, it really is it's an interesting experience just to what we call join people on the journey of their kind of beauty journey through life. And it's really interesting because your concerns and that kind of change over time, and also being on TV every day, it really kind of limits some recovery things. And so as we're planning different things, events, non-surgical and surgical procedures, we have to be, cognizant and careful about all of that. So I always, think it's really important to talk to patients three-dimensionally about their skin. I think it's the largest organ of our body, but it's the most neglected. I think it's kind of out there. And so when we look at the face in particular, we look at the surface, and then we look at wrinkle lines, and then we look at the structure. So what's really interesting is just looking back on your journey, you kind of started on the surface, so like skincare, those sorts of things, and then evolved eventually into wrinkle lines, skin tightening, and then eventually into structural, changes with actual surgical procedures on the face and neck. So maybe tell us a little bit about that journey that you had.
Yeah, so in 2012, as I was getting ready for my son's wedding, we started to think about, would this be the time that maybe we would do something like a laser treatment? And so therapy was at that point something that you thought really could give me some good results.
Yep.
And it was really terrific, almost zero downtime with
Yeah.
that. I mean, that was kind of one of those, we had it on a Friday afternoon, and by Monday morning, I'm back on television at work. And then what I really appreciate about the laser treatments is the fact that you go through the treatment, and then it is a progression. Almost week by week, I could see that my skin was getting tighter, and it really seemed like everything was lifting up, and I was getting a much more youthful appearance as time went on.
Yeah. So I always talk about Ulthera. We have new SoftWave as well, which is kind of Gen 2 technology for skin lifting and tightening. It really just kind of sets the clock back, so nothing really stops aging. Surgery is our biggest kind of tool in the toolbox to readjust, just the age of our face and those sorts of things. But the non-surgicals are also super effective, and I always tell patients that, just turns the clock back. I get it done every about 3 to 5 years, something like that. Just trying to kick the can down the road a little bit more before I actually have surgery. So, but those are really effective. And then also maybe just comment about skincare. So I kind of think a little bit, it's like going to a dentist. So we have to go to a dentist to get teeth cleaning and, do different things, but also we have to take care of our teeth and our face every day. So it's also, things that we can do to kind of keep up. And there's definitely a difference in medical grade, skincare versus just standard, back counter stuff. So.
Yeah, so for me, I always appreciated that as the approach that you took, because you said we have to start with what are you using on the surface of your skin? Are you making sure that it's clean? Of course, in television, you wear a whole lot of makeup, and you know, making sure your pores are clean, making sure everything is at the end of the day back to allow your skin to breathe while you're sleeping at night, making sure you're hydrated, all of those sorts of things, just to really make sure that your skin as an organ gets the best opportunity to be as healthy as possible.
Yeah.